Hi, this is Dr. Renee Watts, and if you are a parent or caregiver of toddlers or school-age children, I've got some tips to share with you today on keeping your kids' teeth healthy. So if you've already been helping them brush their teeth, that's great. Just continue doing that until they have the ability to tie their shoelaces on their own. They still need some help with the dexterity part of brushing, and so certainly give them the brush, let them practice themselves for a while, but then you just of course want to be supervising what they're doing. Take the brush yourself and go in and check for any missed areas and things like that. Also, we recommend adding a fluoride toothpaste as they become toddlers, and just make sure they're spitting it out. In Oregon, we still have pretty high rates of tooth decay in kids here, and so that's just going to help strengthen their teeth and reduce their cavities. The baby teeth have a pretty important job to do in that they're holding space for the permanent teeth and helping the growth and development of your children's jaws. So in terms of what you're giving them to eat and drink throughout the day, we recommend that if you do give them a sippy cup that they're going to have throughout the day, that you just put water in it as opposed to juice or other juice drinks that may contain sugar, just because that's going to help reduce their risk of decay as well. And in terms of snacks, things that tend to be sticky will promote decay. So whether they're healthier snacks like raisins or dried fruit or a candy, of course, all these things are going to stick to the teeth and help increase their risk of decay. So some healthier options may be fresh fruit and vegetables or some low-fat cheeses, or if they do have a treat, just make sure that they brush afterwards. If you haven't established a relationship with a dentist for your child yet, it's a good time to do that as well. Typically, the Pediatric Dentist Association recommends that kids have their first dental visit about age 1. And if you haven't done that yet, check with your general dentist to see if they treat children. And if not, they can probably give you a referral to a pediatric dentist. And this just lets your dental team check and make sure that everything's growing and developing normally, make sure there's hopefully no cavities and that type of thing. In terms of decay, we think of it a little bit differently nowadays too than we have in the past, in that it's caused by bacteria that live in our mouths, and it can be passed between family members. So if we have, say, strep throat or a cold, we're really careful not to share our spoons or utensils with our family members or kiss them, but tooth decay can be transmitted exactly the same way. And so as a parent or caregiver, one of the best things you can do is just keep your own mouth healthy and make sure that you're healthy, and that'll reduce the risk of your kids getting cavities as well. And just in terms of being a good example too, obviously taking care of your own teeth and just teaching your kids that this is something we do to take care of ourselves. You know, we take care of our teeth on a daily basis. We go to the dentist regularly. It's going to just help teach them those good habits that will hopefully stay with them throughout a lifetime. If you do want to get a little more information, the ADA has this great booklet here on your child's teeth that's got even more tips and information. And so if you call or email the office, we'll be happy to send you one out. So I hope this has been helpful today. Thanks for watching.